Good morning, everyone, and welcome to part 2 of our ABAWD webinar training series. My name is Sydney Skellinger, and I'm an analyst in the ABAWD Policy Unit in the CalFresh Policy section at CDSS. Today I am joined by Amber Bonilla, who is the new manager of the ABAWD Policy Unit, and we'd like to thank everyone for joining us this morning. Last time we met, we discussed a broad overview of the ABAWD time limit rule, including a new option for the 36-month period in California. We talked about our ABAWD population, what our ABAWD population looks like in a broader CalFresh population, and we briefly discussed ABAWD eligibility rules. Today, we will take an in-depth look at ABAWD exemptions. If you missed our first webinar, that's okay. It was recorded and we can get you the information if needed. Our contact information will be at the end of the presentation for you to email. Now, for logistics. This webinar will be hosted in listen-only mode. There are 2 ways to listen in, via your computer or via your phone. Information on how to connect is located on the right side of your screen.
One second, folks. We're having some technical difficulties. We're going to just pause really quickly. Stop showing the screen. I don't know. Okay. It looks to me like people can see where I'm at now, hopefully. Please let me know if we need to circle back on something. I can go back. So, as I said, looking ahead to 2018, work groups and trainings will continue, and counties should begin planning any necessary business process changes that they may need, and also planning for training needs as well. And then in roughly February or March of 2018, CDSS will submit our next waiver request to FNS. We know that this will not be a statewide waiver, but at this point it's unclear exactly which counties may lose time limit waiver eligibility. And as a reminder, this waiver request is based on 24 months of unemployment data, which is not yet available. We hope to have a response to our waiver request shortly thereafter, and we'll be staying in communication with counties to keep them informed of their likely time limit waiver eligibility. Okay, so 6 months ahead of implementation, we enter a phase of critical preparation, and at this point in time, counties should have a sense of their time limit waiver eligibility and whether or not they will be implementing the ABAWD time limit. On September 1, 2018, the statewide waiver will expire, and some counties will be required to implement the time limit at that time. And communication with clients, including exemption screening and notification about the time limit rule, should happen well in advance of September 1. Also, for those counties required to implement the ABAWD time limit, participation tracking will begin. Looking forward from there, in December 2018, we'll have wrapped up our second year and our first 36-month period, and the first wave of ABAWD subject to the time limit may be potentially discontinued due to exhaustion of their 3 countable months. Again, countable months are those months in which an ABAWD who's not exempt and subject to the time limit receives a full benefit allotment while not meeting the work requirement. Just want to do a quick check-in to make sure people can hear okay and can see. I'm seeing some questions come in. Okay. We can hear and see. Okay, perfect. Thank you, Jen. That was a great suggestion. Okay, hopefully that's a little easier for folks. And thank you so much for sticking with us during this trial period. This is what happens when Alexis goes on vacation. So we'll just have to tell her no more vacations. So a quick review of our ABAWD time limit rule. ABAWD eligibility is limited to 3 full months in a 36-month period while not fulfilling the work requirement or being otherwise exempt from the time limit. It applies to individuals that are age 18 to 49 who have no dependent children and who do not qualify for an exemption. And it requires those individuals to work or participate in a qualifying work activity for at least 20 hours per week or 80 hours per month on average. So wanted to circle back on our CalFresh population graph just to show that today we'll be focusing on the third innermost circle of ABAWD individuals who are exempt from the ABAWD time limit. So how do we determine if someone meets criteria for an ABAWD exemption? And the answer is effective screening. Because such a significant portion of the ABAWD population may be exempt from the time limit, effective screening and client communication is crucial. Counties may or may not have enough information in the existing case record to determine whether or not a client is exempt from the time limit. So a combination of both effectively using the information that is already available in the case file and individualized assessments by eligibility staff will be required in order to fully assess if an individual meets criteria for an ABAWD exemption. So there are 2 points where ABAWD exemption screening is particularly critical. The first being screening your existing caseload. Counties who lose ABAWD waiver eligibility will need to screen their existing caseload well in advance of September 1, 2018, which is again when the statewide ABAWD waiver expires. Many states that have implemented the time limit have identified this as a critical step and suggest beginning a minimum of 6 months in advance as a best practice, and CDSS is working diligently to be able to inform those counties that are potentially going to lose their waiver eligibility in enough time to account for proper screening. The second thing counties should be starting to think about is building screening into existing and ongoing business process. This includes training eligibility workers to be diligent in exploring exemptions while interacting with clients, either through utilizing tools that will be provided by CDSS to aid in that assessment or other methods. And also ensuring that at each communication with the client, whether it's at SAR 7, mid-period, or recertification, that they're being screened. And third, utilizing information that may be accessible in the case file to aid in screening. So if, for example, it's indicated in the case record that an individual is receiving a homeless shelter deduction, you know that you may be able to exempt them from the ABAWD time limit. And lastly, for new applicants, many of these same principles apply, but counties should use an ABAWD screening tool during the intake interview, whether that's over the phone or in person. And this can be one developed by CDSS, which is currently in draft, or another version developed by the county or by our ABAWD outreach team. Next is innovation. In order to aid in the administrative workload that comes along with the ABAWD time limit, other states have created specialized intake units along with specially trained eligibility workers for this specific purpose. And finally, supporting clients in obtaining verifications when needed. This can be through tools developed by CDSS. It can be through utilizing collateral contacts or other means in obtaining verifications, and we'll dive into verifications in just a few minutes. Another critical piece when thinking about the ABAWD time limit and ABAWD exemptions in particular is client communication. Clients need to understand the rule in order to avoid losing benefits, and we know that this is a very complicated and difficult rule to understand. So we want to emphasize that we can never be clear enough. So in this case, it's definitely better to over-inform than to under-inform. Clients also need to be aware of what the new requirements are and what information may be important for them to communicate to the county. Sorry about that. Sorry about the feedback. So this is somewhat of a paradigm shift or a fundamental change in approach, if you will. For the last few years under simplified reporting, we've instructed clients that they only need to report if they receive income over their income reporting threshold or their IRT. And with the implementation of the ABAWD time limit, not only is there an additional required report, which we'll cover in a future webinar, but there may be changes in a client's circumstances, maybe during their certification period or even after they've been discontinued, that we will want clients to communicate to the county. These changes may qualify them for an exemption from the time limit or could even result in an engagement opportunity, for example, with CalFresh E&T, or even a volunteer opportunity at a community-based organization. And finally, communication should be frequent. Frequent communication includes reiteration of the time limit rules, exemption criteria, and how they can meet the work requirement. And these are really key in effectively engaging the client and maintaining benefits. And I also wanted to note that our outreach team is currently developing materials that can be used to explain ABAWD rules to individuals and help them understand their obligations with the new rules. So folks should see some pretty interesting materials coming out fairly soon from our outreach team. The good news is that community partners can help, and partnering with your community stakeholders and outreach partners is another crucial piece to successful implementation, along with effective screening and client communication. They can raise awareness and assist in getting the word out about the ABAWD time limit. They can also display posters or distribute flyers, and also communicate with other stakeholders about the time limit rule. And in some cases, community organizations may also be able to provide application assistance specific to ABAWD individuals, including assisting in verifying exemptions. A community partner may, for example, help someone get a medical verification form filled out or signed by a doctor or other medical professional if needed. And they can also refer clients back to the CWD or other community partners if they need more assistance. So what are the ABAWD exemption criteria? We're going to begin with a scenario. It's post-September 1, 2018, and you have a client that comes into the county office and applies for CalFresh benefits. This person is 32 years old and is a household of one, and he has no dependents. So during the application process, the eligibility staff have determined that this individual is an ABAWD, but the next key question to ask is he exempt or is he subject to the time limit? So let's explore. We know that many ABAWDs face significant barriers to employment. So the question we need to ask is, does this individual's circumstances hinder their ability to participate in work or work activities for 20 hours per week or 80 hours per month? The ABAWD time limit exemption categories are intended to identify individuals who are not able to satisfy the work requirement for any number of reasons. And we're going to walk through each of the different exemption categories and explore the criteria for each, and also provide a quick overview of what types of verification are necessary for each. So clients are exempt from the ABAWD time limit for any of the following reasons. First, if they reside in a household with a member under the age of 18. For the purpose of the ABAWD exemption, a household means a CalFresh household. The child can be an ineligible member of the CalFresh household for any reason. They can also be temporarily absent from the home, but for no longer than 30 days. And the ABAWD individual is not required to be a parent of or even responsible for the child. And no verification is required for this exemption because the information is known to the county. Also wanted to pause here for a second because of our technical issues in the morning. We forgot to mention that if you would like to ask a question, please ask those questions in the question box so that we can keep a record of them, and we'll do our best to answer as many of them as we can this morning, and we will be releasing a frequently asked questions document at some point in the future, probably at the end of the webinar series. So we'll be keeping a record of all the questions everyone asked, so please make sure to ask those in the question box. So next, pregnancy also exempts an ABAWD from the ABAWD time limit. And for the purpose of this exemption, that's any stage of pregnancy, and that's effective beginning the month of conception and applies until the month of the child's birth. And for this exemption, client statement is sufficient verification. Next, individuals who are exempt from work registration are also exempt from the ABAWD time limit. The work registration exemptions are as follows: if they are under the age of 16 or over 59, if they are attending school or enrolled in an employment and training program at least half-time, if they are physically or mentally unfit for employment, if they are complying with CalWORK's welfare to work requirements, if they are caring for a dependent child under the age of 6, if they are caring for an incapacitated person, and for the purpose of this particular work exemption, work registration exemption, the incapacitated person does not have to be a part of the CalFresh household or living in the same residence as the ABAWD individual. If they are receiving or have applied for unemployment, if they are participating in a drug or alcohol treatment program, or if they are employed or self-employed for a minimum of 30 hours per week. So while there is some overlap, work registration requirements, including determining a work registration exemption, are separate and apart from the ABAWD time limit. County systems are currently set up to screen household members and determine whether or not they are work registrants or exempt from work registration. So this, therefore, for this information, it will already be known to the county and no additional verification is required. And further instruction on CalFresh work registration can be found in ACIN I-0113, which I've linked for you at the end of the presentation. Next, an individual is considered exempt from the ABAWD time limit if they are physically or mentally unfit for employment. And a person is considered physically or mentally unfit to work if they have an illness, disability, condition, or life circumstance, whether that's temporary or permanent, that reduces or affects their ability to work. So within this broad exemption category, there are a number of subcategories, each with their own criteria, which we'll explore in detail. So the first being individuals who have applied for or are receiving temporary or permanent public or private disability benefits. Sources include, but are not limited to, any rating of veterans' disability benefits, workers' compensation, SSI in a non-pay status, but only for the months that those SSI benefits are not paid, or a pending application for SSI, and state-issued temporary or permanent disability benefits. Verification for this exemption could be proof of receipt or a pending application, and this information may also already be known to the county. Next, Individuals who are obviously unfit for work are exempt from the ABAWD time limit. This determination is made by the eligibility worker during the intake or recertification interview, either face-to-face or via phone. And some examples of obvious unfitness for work include observing that a person may have an injury, such as a broken arm, and they're wearing a cast, maybe noting that a client is having trouble following the interview or is asking incoherent questions. The eligibility worker may note that the client has some severe dental issues or personal hygiene issues, and et cetera. Because this determination is made by the eligibility worker, adequate and detailed case notes are going to be essential for determining whether the exemption is properly applied. This is especially important if the case is pulled for review and the reviewer is trying to recreate case circumstances. And we do recognize that this determination may cause some unease, but we want to emphasize that this determination is solely for the purpose of exempting an individual from the ABAWD time limit, and that eligibility workers should feel empowered to make the determination. Federal rules do allow states or counties, in the case of California, this flexibility in order to prevent placing unnecessary burden on individuals who are clearly unfit for employment. And I also wanted to note that we've discussed this exemption in particular extensively with other states and within the ABAWD work groups, and we've identified some potential solutions that may provide support in making an obviously unfit for work determination. One strategy is to use a triage model and send these more complicated cases to seasoned eligibility workers who may be specially trained in making this particular determination. And another option that was identified is to create a specialized unit dedicated to processing ABAWD cases. Many states have opted to create specialized ABAWD units, including CDSS, which has dedicated a policy unit to the ABAWD time limit. And next, not all individuals will have an obvious unfitness. So if the unfitness for work is not obvious, the CWD may request that an individual provide a medical certification of the unfitness. This certification includes a written or verbal statement from a broad range of medical or mental health professionals, including physicians, nurse practitioners, dentists, social workers, et cetera. Verification of this exemption could consist of a signed CalFresh request for medical or mental health verification form, which is currently in draft and was developed in partnership with our work group. Or it could be a written or verbal statement from the medical or mental health provider. And also want to note that verification should support the anticipated length of the unfitness for work in this case. Next, individuals who are chronically homeless are also exempt from the ABAWD time limit. Chronic homelessness is defined as lacking a fixed and regular nighttime residence. An individual whose primary residence is a supervised shelter designed to provide temporary accommodations, a halfway house, or temporary accommodation in the residence of another individual for less than 90 days. Or a place that's not designed or ordinarily used as a sleeping accommodation, such as a hallway or bus station. In addition, if an individual is coded as living in a homeless shelter or coded as receiving the homeless shelter deduction in their CalFresh benefit calculation, could also be an indicator that a person is chronically homeless. Verification for this exemption may also already be known to the county, and if not, client statement is acceptable. Also wanted to flag that the question of living in a residence that is not their own has come up as a frequent question for this exemption, and in the handbook we've clarified that if a person attests that they are consistently living in someone else's residence, then they are not considered homeless for the purpose of establishing an exemption from the ABAWD time limit. And for this purpose, consistent is defined as not more than 90 days. Individuals who are struggling with drug or alcohol addiction are also exempt from the ABAWD time limit. This is defined as, but not limited to, participating in a drug or alcohol treatment program or rehabilitation program. And to be clear, this exemption does differ from work registration in that the individual does not actually have to be participating in a treatment program to qualify. They only need to indicate that they are struggling with addiction in order to qualify for this exemption. So verification of struggling with drug or alcohol addiction includes a verbal or written statement from a medical professional. If they are participating in a treatment program, they may provide proof of that participation, and if no other source is available, client statement is sufficient. Finally, the last ABAWD exemption is escaping domestic violence, and this is defined as an individual who is fleeing from any type of assaultive, coercive, or battering behavior occurring within a domestic relationship. Verification for this exemption can include a verbal or written statement from a medical or health professional, and client statement is sufficient as well if no other verification is available. So some final thoughts on ABAWD exemptions. We want to acknowledge that verification is flexible and that there is a lot of gray area surrounding ABAWD exemption verification criteria. As you'll note, you heard that there is excuse me, some flexibility about the types of verification that are acceptable. In general, we do want to maintain our current approach and the approach that's required by federal rules, which is that documentary evidence should be used as the primary source of verification if it is available. This includes assisting the client to get that documentation, as it is our responsibility to make the effort to support the client in securing verifications. We do know, however, that documentary evidence may not exist for many of the ABAWD exemptions, and if no other sources are available, then client statement is sufficient with adequate case narration. Detailed case narration really is key, no matter the type of verification used, in order to recreate case circumstances, as these are potentially very complicated cases. And also wanted to reiterate that the option is always available to verify any information that is deemed questionable, with the caveat that you want to avoid putting any unnecessary burden on the client. So temporary versus permanent exemptions are typically granted for the length of the certification period unless there is solid evidence to suggest that an exemption will end within the certification period. And so in these cases, exemptions can be granted temporarily with a required follow-up at the anticipated end date of the exemption. And finally, wanted to talk a little bit about retroactive capability. And it is possible to retroactively apply an exemption to an ABAWD individual's case if you find out that the individual met criteria for an exemption but didn't report it. So for example, if a woman who is subject to the time limit finds out that she's pregnant in the 3rd month of her pregnancy, and she reports it to the county because at this point she's been so well educated about the time limit and she knows she's exempt, you may go back and apply that exemption to her tracking calendar and remove any countable months that she may have used during the time that she was actually exempt. Okay, so we wanted to end with some key takeaways for counties and community partners before the Q&A portion. And we think counties and community partners can start by discussing a couple of key questions. How will counties and CBOs identify an individual and assess ABAWDs for exemptions? How can client-facing materials best reflect the return of the ABAWD time limit? And what training needs do your staff have? Who are potential partners? And what will be most difficult about finding exempt individuals, and how can we find a solution? And also start engaging ABAWDs through education and work opportunities and leaning in on those community partnerships. Okay, so at this point, I just wanted to thank everyone again so much for sticking with us through our technical difficulties this morning. At this time, that brings us to the end of our presentation, and we'll open it up for questions. So as a reminder, please submit your questions in the question box, and we'll be keeping a record of those questions to follow up. So if you can just give us a couple of seconds to open the question box. And we will start looking through these. Here we go. Okay, so Sydney's going to read a couple of these questions off, and we'll do our best to get those answers.
All right. First question. Does reporting responsibilities apply to exemptions? In other words, do ABAWDs have a responsibility to report their exemption status changes mid-period?
Okay, that's actually a really great question, and the answer is no. The only required reports for ABAWDs are income received over their IRT and a drop in ABAWD work hours below 20 hours per week. So as I just mentioned, typically exemptions will be granted for the length of the certification period, but there could be some cases where a temporary exemption is appropriate. If, for example, a client comes in with a broken arm, let's say, and knows for sure they will be getting their cast off in 8 weeks, the county could grant a temporary exemption for that client and set a task or other reminder to follow up at the expected end date. So I'm seeing also lots of questions about sharing some of the tools and forms that we've developed, and we can absolutely do that. A lot of them are in draft, and they're with our forms management department. So once we get some mock-ups of those, we can share them out.
All right, next question is, can a client be exempt based solely on a doctor's note, or would we require that a CW 61 form be completed?
So I'm not super familiar with a CW 61. I believe it's the CalWorks medical verification form, but I will say that a doctor's note is acceptable in order to verify if someone is unfit for work. And just a reminder that a note is not required if that unfitness is obvious to the eligibility worker. So if it is obvious, the eligibility worker only needs to document in the case record. You can also accept a phone call from a doctor or other health professional. And in the draft handbook, we've outlined a whole list of medical professionals that can verify if someone is unfit for work. And again, as a note, we've also drafted a medical verification form that can be used. It's not required, but just wanted to provide it as a tool for folks if they need to get a verification form filled out. And that'll be made available to counties soon.
All right. The next question is about an exemption. For the responsibility for the care of an incapacitated person, do they have to live in the same address or home?
I believe that we discussed this in an earlier slide, and I can reference back to that, but the answer is no, that the person does not have to be in the CalFresh household or live at the same address.
Okay. The next question. What do we do if there is more than one exemption reason? How do we choose?
So if I am channeling my inner Alexis, I would say that you'd want to choose the exemption reason that maximizes eligibility for the client. So for example, if you have a client that comes in with a broken arm and they tell you that their cast is coming off in 6 weeks, like I used an example of earlier. But through the interview process, you also determine, you find out that maybe this person is attending AA meetings. You'd want to choose the exemption that would last through the length of the certification period, because you know this person is struggling with addiction, so you could make adequate case documentation and exempt them from the time limit for the remainder of their certification period. Okay, we're still filtering through some of these questions, so bear with us. One of the questions is, are there outreach materials being developed and when will they be made available? And the answer is yes. We did have an outreach and training work group that we kind of split into two. So the training portion of the work group is this ABAWD webinar training series, and our outreach partners are in the process of developing an ABAWD toolkit. I'm not sure when that will be made available, but I can get that information to you, and of course will be shared out as soon as it's ready.
Dr. Drop.
We're on a webinar. Let me find, I think we have enough time for one more before we wrap up here. This next question is, does a child under 18 living in the home have to be purchasing and preparing meals with the household in order to be exempt from the ABAWD time limit? And I think the question is, will the ABAWD, does the child have to purchase and prepare in order for the ABAWD to be exempt? And the answer is yes, the child does have to be a part of the CalFresh case. They have to be in the household, even if they are an ineligible member. For example, if they are a non-citizen child, they could be ineligible for any reason, but they do need to be a part of the CalFresh household. So for the sake of time, we're going to end with a couple of next steps, and just want to thank everyone for hanging in there with us and for submitting such great questions. I apologize, our Q&A time was cut a little bit short, but we will definitely be using these questions to inform future webinars, and the information that we don't discuss on a webinar, we will be releasing a question and answer document that's comprehensive at the end of this series. So thank you so much for asking those questions. So next month, our next webinar is going to be narrowing in even further on our ABAWD population to those who are subject to the time limit, and we will be taking a deep dive into satisfying the work requirement. Alexis will be back on vacation by then, so there will be hopefully no hiccups and it will all go smoothly. Finally, there are some resources linked here for you that I think are helpful, that I constantly reference myself for both work registration and for the ABAWD time limit. And then my contact information along with Sydney's. Please feel free to reach out anytime if you have questions. We will make this recording and all materials available. We will send it out today. Please, again, reach out if you have questions or if you need any other assistance in getting the materials from the last webinar. So again, thank you so much, everyone, for your participation and your patience this morning, and we will see you next month.